So tennis elbow is a painful overuse injury that affects the elbow from too much gripping, too much wrist movement, things like raking leaves, cooking, carrying groceries for the holidays. So you'll have pain on the lateral aspect of the elbow right through here. So to treat lateral epicondylitis or tennis elbow, I like to use a technique called Graston, which breaks down the affected painful tissue, and we trigger to the body a new healing response. So we increase blood flow, push out pain cells, push out inflammation cells. One of the exercises I love to do is a wrist eccentric. So by doing an eccentric, you're doing a strengthening and a stretch. So you're putting that tendon under a lot of stress by increasing blood flow and all that good stuff to that area. So here at home, you can use a water bottle, a can of soup, a light weight. So you're gonna come up and hold 5 seconds, 5, 4, 3, 2, 1, and then down. 5, 4, 3, 2, 1. You're gonna come right back up. Hold for 5, 5, 4, 3, 2, 1, down. 5, 4, 3, 2, 1. You wanna do about 10 reps, 3 sets. So all you're gonna do is you're gonna take that wrist, you're gonna bend it down, and you're gonna push kind of on the top of your hand, and you should get a nice stretch right over the top of the forearm right through here. Again, you wanna hold this for about 15 to 30 seconds. Do that 3 or 4 times throughout the course of the day. So here you're gonna use a dumbbell. This is a 5-pound dumbbell, and she's gonna do what we call a radial and ulnar deviation of the wrist. So she's gonna go down, and she's gonna come back up. Again, eccentric strengthening, so hold for 5, 4, 3, 2, 1, down, 5, 4, 3, 2, 1, back up. The reason that we do this one is it's affecting the muscle that is most involved, which is your ECRB, your extensor carpi radialis brevis. That's the one that's most commonly affected, and this is the best exercise to target that muscle.